Andrew, do me a favour. He needs some potassium in the IVI.
Right.
Come with me. How could you be so stupid? I saw Conroy ask you to put him out of his misery. I asked you to supplement his IVI with potassium, and instead you inject it as a bolus, knowing full well it'll kill him. Relax. There was only water in the syringe.
What?
We've been through this before. You can risk overdosing someone if you're trying to treat profound distress. But giving someone a lethal injection that has no medicinal value is murder.
I thought I was doing the right thing.
I'm surprised you want to play God. The hours are even worse and there's no prospect of promotion.
So why would you want to protect me?
Andrew, this is a war we're in. Against nurses, against consultants, against the outside world. You ought to realise that you and I are on the same side.
Oh, it's sides. I thought maybe you and I were becoming friends. Silly me.
Is that the QE2 in your pocket, or are you just pleased to see me?
That's my bleeper.
You and Monica never really did hit it off, did you?
No, I don't suppose we did.
Raj, are you all right?
Why shouldn't... Do you know when you told me that Monica had killed herself? Do you know the first thought that crossed my mind? God, there's going to be so much more to do on the ward.
Yeah. Patient in resource. Pepperoni.
Claire, little girl brought in collapse coming up to 15 minutes. She's had adrenaline, atropine, no shocks.
Didn't ask for the RMI.
No, I did.
50 Jill shot, please. Is there a paediatrician on the way over from the general?
Yeah, it must be caught in traffic.
What happened?
I think it was an accident on the merry-go-round.
Shot, please.
Two. Three.
Still asystole. Continue CPR, more adrenaline. Someone get me a brown Venflon and a 50ml syringe. Looks to me like she's had a heck of a whack on the chest.
Tamponade.
You're damn right, tamponade. Adrenaline. More adrenaline.
1, 2, 3, 4, 5.
Stop resuscitation.
called you down because Dr. Poe was dithering but wouldn't admit that he needed help.
You did the right thing.
If he'd thought of tamponade right away, would it have made a difference? You must have seen a few tamponades before.
The first one.
Karen, do we have any details on this little girl?
Her name is Lucy Buxton. She was 7 years old. I'll go and tell her mother.
I resent the way you talked down to me earlier on. You should learn to treat your fellow doctors with more respect.
I can respect my fellow doctor, but I'll be damned if I'll respect you.
Isn't there anything you can do to stop him suffering so much pain?
Would you excuse us a minute, please, Mrs. Conroy?
I don't know what more we can do.
You're a caring and sympathetic doctor who's never going to become cynical. I know he'll do the right thing.
Trouble?